Hello, lovely people. Welcome back to Lively Healthcare channel. So here we continue with our second session about some questions about diabetes. So here is Mr. Nawaz, nurse with us. So let us continue with him. Hello, Mr. Nawaz. Welcome back to our channel.
Hi, thank you, Mr. Mazhar. How are you?
Yeah, very good. And let's continue from the previous chapter what we actually discussed about diabetes.
Yeah.
Now we have a question about what is hypoglycemia.
Yeah, so hypoglycemia basically, Mr. Mazhar, is a low sugar in your blood. Hypoglycemia is a basically fancy word of the low blood pressure.
Oh, I see.
Low blood sugar.
I see. Okay.
Yeah.
And how somebody can determine that he is actually having low blood sugar? What are the symptoms that a person could recognize?
So when you have there's a scale for the glycemic index.
Okay.
So if your hypoglycemia index is less than 3.6, it called clinically low blood sugar.
I see. Okay.
And if it's on the 6, it's on the border.
I see.
And millimole per
I
liter.
see. Okay.
And if it's a more than 6, it's a diabetic.
I see.
At the border, you are pre-diabetic.
I see.
So you need to be cautious that you are on the border.
I see. Okay.
So if you are more than 6.4, so you are diabetic.
Type 2.
Type 2.
I see. Okay.
Okay. So this is a glycemic index.
I see.
So hypoglycemia basically equal dangerous than the hyperglycemia.
I see. Okay.
But still, is a sign of symptom of the hypoglycemia is your heartbeat will be fast.
I see. Okay.
And then you will be shaking.
I see.
And you will be nervous. And you would have a lot of anxiety and confusion.
Okay.
And then you would have a dizziness. And you will feel more hungry.
I see.
So these are the classic sign and symptom of the hypoglycemia or low blood sugar.
Oh, I see. And what do you think if somebody feels that he is having low blood sugar? So do you think he should prevent about daily living, maybe the regular work what he's doing?
So first of all, if you feel that kind of symptom, first of all, take some sweets.
Okay.
Like a candies.
I see.
Right?
Okay.
And that's like a recover from that level.
I see.
And the causes can be a many factor.
I see.
And there's a lot of factors. Like if somebody is taking insulin and he feel this sign and symptom of hypoglycemia, so it means he took insulin, but he did not eat a carb appropriately.
I see. To balance it.
I
see. Okay.
And the other thing is that he might have consume more alcohol.
I see. Okay.
That is cause. And then the timing of the insulin.
I see.
That can be a cause. And also if you are if you are traveling in high altitude for the longer period of time.
Oh, I see.
It can be participate to the blood.
I see.
Low blood sugar.
Oh, okay.
So if you are traveling, for example, it's a tips and education. If you are traveling, just keep your blood sugar test equipment with you.
Okay.
And before even driving,
I see.
You should be mindful. Some people actually are asymptomatic of the hypoglycemia too.
Okay.
So that is a more dangerous when you get in the behind the wheel.
Okay.
So that is also dangerous. And even if you are traveling by air, so you should be mindful that altitude can cause low blood sugar. Okay. And so the immediate assistance in this case, if you or you're someone is feeling those symptoms, so he's confused, so he's not. So take some sweet candy.
I see.
In the mouth, so it can be a recover from that situation. But it's really, there's a lot of factors who contribute to the
I see. Which can contribute to the low.
For example, if you are like a excessive activity, physical activities.
I see.
And then timing, of course, how long you've been exercising. If you are like a more exercising, that also can.
Yeah, let's say we're in Canada, and we have a lot of snow this year.
Yeah.
So if somebody's actually shoveling his snow from his driveway, so you think excessive workout will possibly cause him a low blood sugar as well.
And then sometimes some people actually report, some of my patient reports that if they have drinking coffee, so coffee is diuretic.
I see.
And it also causes fluctuation in the blood sugar.
Oh, I see. Okay.
So it's a hype up and then collapse.
Yeah, it collapses. I see. Okay.
So that is not good for the patient, diabetic patient.
Okay.
Just be on the regular thing.
I see. Okay. Anyway, thank you very much, Mr. Nawaz. And thank you very much for watching us. And if you have any comments, please just leave your comments in our comment section, and we'll try to answer all the questions which you have. So please come back again. Have a great day.
Thank you very much. And at the end, I would say that this is your health, and take care of your health and take charge of your health.
Thank you, Mr. Nawaz.
Thank you very much, sir.